When it comes to detecting cancer, many people hear about PET scans and think they're the ultimate answer. After all, these scans can light up cancer cells before they're even visible on other imaging tests. But does that mean PET scans always get it right? Today, let's explore what PET scans can and can't tell you about cancer and why doctors almost never rely on them alone. A PET scan, or Positron Emission Tomography scan, works differently from CT or MRI. Instead of showing the structure of organs and tissues, PET scans reveal function, specifically how active the cells are. Doctors often use a sugar-based tracer called FDG, which is absorbed quickly by cancer cells because they need more energy to grow and divide. That's why PET scans are so powerful. They can highlight abnormal activity even before a tumor changes in size or shape. One of the biggest strengths of PET scans is their ability to stage cancer and track treatment response. For example, during chemotherapy, a CT scan might show a tumor is still the same size, but a PET scan can reveal that the cells inside are less active, meaning the treatment is actually working. This makes PET invaluable for oncologists when deciding whether to continue, adjust, or switch therapies. PET is also helpful in checking whether cancer has spread to lymph nodes or other organs, which is critical for planning treatment. But as impressive as they are, PET scans have limits. Sometimes they can give false positives. This means the scan lights up areas that look suspicious but aren't actually cancer. For example, infections, inflammatory conditions like arthritis, or even healing tissue after surgery can show high metabolic activity. These spots can mimic cancer and create unnecessary worry until further testing clarifies what's really happening. A study in the Journal of Nuclear Medicine shared the case of a patient with colon cancer who had undergone surgery. Months later, their PET scan showed a glowing spot near the surgical site. Naturally, the first thought was cancer coming back. But further testing revealed it was simply inflammation from healing tissue. This is a reminder that not every hotspot on a PET scan means cancer. Researchers have also documented how PET scans can reveal treatment response in esophageal cancer. One patient with esophageal cancer still had a mass showing up on CT after treatment. But when doctors looked at the PET scan, it revealed that the mass wasn't active anymore. The cancer cells were essentially dead. Without PET, the patient might have gone through major surgery unnecessarily. PET scans can also give false negatives. Some cancers grow more slowly and don't absorb the tracer strongly enough to stand out. Prostate cancer, certain types of thyroid cancer, and some low-grade lymphomas are examples. PET can also miss very small tumors under about 5 millimeters, simply because the scanner can't pick them up. This is why doctors often follow up with biopsies or other scans when something doesn't quite add up. In short, PET is excellent, but not flawless, which is exactly why no doctor relies on it alone. This brings us to how PET compares with other imaging methods. CT and MRI scans focus on anatomy. They show the size, shape, and location of tumors, almost like a snapshot of the body's architecture. PET scans, by contrast, focus on metabolism, showing whether the cells inside are active or not. One way to think about it is like looking at a house. A CT or MRI scan shows you the blueprint. The walls, the rooms, the layout. You can see where everything is, but not what's happening inside. A PET scan, on the other hand, shows you which rooms have the lights on, or even which rooms are using more electricity than usual. That's the equivalent of detecting unusual metabolic activity in the body. Now imagine putting the two together. PET CT or PET MRI doesn't just give you the blueprint. It shows you both the structure of the house and the rooms where activity is happening. That combination helps doctors see not only that a lump exists, but also whether it's active cancer or something benign. This is why combined scans are considered the gold standard in many cancer centers. For example, if a CT scan shows a small mass in the lung, PET can reveal whether the cells are metabolically active, suggesting cancer, or whether it's just scar tissue. In the brain, PET MRI is particularly useful because MRI gives such detailed images of soft tissue, while PET shows which areas of the brain are unusually active. Together, these scans help doctors make more precise treatment decisions, whether that means surgery, radiation, or monitoring. Of course, there are practical considerations too. PET scans involve exposure to radiation, though the dose is relatively low. To put it into perspective, the radiation from a PET scan is about the same as what the average person is naturally exposed to over 3 to 5 years of everyday life. It's higher than a chest X-ray, but generally less than or similar to some CT scans. Doctors always weigh the risks and benefits carefully, which is why PET is ordered only when it's likely to provide essential information for diagnosis or treatment. Cost and availability are also important factors. In the United States, a PET scan can cost several $1,000s, though insurance may cover part or all of it depending on the case. In countries with public healthcare systems, like New Zealand or parts of Europe, access may be limited by funding criteria, meaning not every patient will automatically qualify for a PET scan. And not every hospital has a PET CT machine, so sometimes patients need to travel to specialized centers to have one done. So, what does all this mean for patients? Simply put, PET scans are one piece of a larger puzzle. Your doctor may recommend additional tests like CT, MRI, biopsies, or blood work to get the clearest picture. This layered approach protects patients from misdiagnosis and ensures treatment decisions are based on the best possible information. It also explains why you might be asked to do more than one type of scan. Each test answers a slightly different question. To sum it up, PET scans are game changers in cancer detection. They're excellent for spotting active disease, monitoring response to treatment, and even detecting recurrence early. But they do have blind spots, and that's why no oncologist relies on them alone. Think of PET scans as powerful guides, not final verdicts. Their real strength comes when they're combined with other imaging and clinical information. And if you'd like to take the next step and explore something practical you can do for your health right now, check out our video on 10 red foods to unclog your colon. It's a helpful guide to everyday foods that support digestive health and may lower cancer risk, the kind of simple lifestyle choices that complement what medical scans like PET are designed to detect. If you found this video helpful, give it a thumbs up and share it with someone who may benefit from this information. Don't forget to subscribe for more health and wellness videos, and if you'd like to support our work, consider tapping the Super Thanks button or checking out our channel merch. Every bit of support helps us keep creating valuable content like this. And now we'd love to hear from you. Have you or someone you know had a PET scan? What was the experience like? Your stories and insights in the comments not only help us, but also help others going through the same journey feel less alone. Thanks for watching. Take care and wishing you good health and peace of mind.